Okay. Hi, Dr. Haas. How are you?
Wonderful. How are you?
Doing great. Thank you. Thank you for coming on the show. Nice to see
Thanks for
you.
having me. Likewise.
So, you're here to talk about your mouth and teeth and all that kind of wonderful stuff today, yeah?
Yeah, for sure. And I'm here to find out what would your mouth say if it could talk.
Oddly enough, a lot of people's mouths move and they talk, but you don't know what they're saying.
That's
It's,
right. So when I was coming up with the title for my book, of course, if your mouth could talk, our mouths talk, but we talk through our mouths, but really our mouths don't talk on their own. So that was a twist on the title.
let me ask you, what is a dentofacial orthopedist?
So I'm an orthodontist and dentofacial orthopedist. So because it's our full name of our dental specialty. So I'm first a dentist, general dentist, and then I had a 3-year extra years of residency to get my orthodontics and dentofacial orthopedics. Orthodontics, I don't know if you've had braces or any of your family members, but is about moving teeth. Dentofacial orthopedics is about facial growth and development and changes to that. So we are experts in not just teeth movement, which most people know, but we're also experts in the whole mouth and facial structure and in its development and all the issues that come up. And so that's why sometimes we get involved with children much, much younger than when they have all their permanent teeth, because our goal is not just to get the teeth straight, is to make sure they have the correct growth of the jaws, the correct airway, so they can breathe better, they can sleep better, their facial proportions are in harmony. And so that's really a big part of my specialty. It's not just this part that's the teeth, but the whole facial structure.
Oh, I see. Are you a surgeon?
No, I'm an orthodontist and dentofacial orthopedist. So it's really has to do more with the growth and development. So I'm really involved in, let's just say, I'll give you an example. You have crooked teeth, you put braces on, but let's just say you have a child who has an underbite, or he has an overbite, or an open bite, or jaw discrepancies, which is really not related to the teeth, has to do with the growth of the jaws. So we use devices, we use plans from early on, really very early on sometimes, to then help the guide and growth and development of the jaws and the face of that child. So as they grow more proportionally and turn out to be a normal facial growth. So that's the other area. But so we don't do the surgical part of it. We have oral surgeons and maxillofacial surgeons who do the surgical part of it. But that's usually when we miss the opportunity to treat them when they were younger. When you're young, your mouth is still growing, your jaws are still growing, your face is still growing. So we have devices that modify the growth of the face. When you're not growing, it's just you're a teenager or you're an adult, then we work with the oral surgeon and maxillofacial surgeons we do the teeth part, they do the jaw parts, they surgically move it. But for most of the issues, if you're a young enough person, we can modify the growth so we can avoid surgery.
Oh, I see.
Yeah.
I remember as a kid, I didn't have braces, but there were some kids in my class who had that whole headset thing. Is that what that would be? Something
You mean
like
the
that?
one that goes around your headgear?
Well, there was the headgear, and then there was a couple of them that had things that looked like an antenna helmet.
Yeah, I mean, things have probably changed quite a bit, even since I had braces when I was a kid. I had it again as an adult. I don't think there is really anything we use in orthodontics right now that it goes outside of the mouth. But so almost 99% of stuff, at least, that all the devices that we have goes inside the mouth. So they're a lot more cosmetic. Kids can wear them to school. They're not going to get teased. We actually want to improve people's self-confidence. We don't want to destroy it. So I remember those were terrible. When I was growing up, I know a lot of kids wore like these headgear devices and stuff on their faces. Those are really, I can't imagine like maybe a very unusual circumstance that any device like that will be used. Most technologies that we have right now go in the mouth. Many of them, you can't even see them. We even have braces that go behind the teeth completely. They're completely invisible. Obviously, we have aligners, like clear aligners, but those are still visible a little bit. We have braces that go behind your teeth completely. So things have gotten a lot more aesthetic. They're a lot more comfortable than they used to be when I was a kid. And they're more efficient. They require fewer visits. So it's just technology in dentistry and orthodontics has improved dramatically over the last 10 or 20 years.
Well, those big headsets, I mean, I can remember the joke about if he opened his mouth just the right way, he could pick up radio.
I used to joke with my patients when I would put some, this is like 20 years ago, even regular braces, they always ask me, Dr. House, would I like beep when I go through the airport? Because, they feel like they have some metal. And I'm like, I don't think so, but I'll give you a prescription to show it to the security guard if you need to. But I'm just kidding. It's such a small amount. You don't beep through the airport.
Well, I'm happy to hear that. I'm happy to hear that things have gotten more cosmetically pleasing, because those things are pretty hideous. Okay, let's pivot over to your book. So your book is called If Your Mouth Could Talk. So what is our mouth not saying to us?
Yeah, so this is a really good question. So by the way, just to complete the story, my wife is a pediatric dentist. And so between the two of us, we have one of the largest group dental practices that focuses on children's oral health from all aspects of it, right? From the clinical side, from the growth and development. So that's really the complete picture of why I wrote the book. It's not just about orthodontics and growth and development. It's really about microbial health and all of that. To your question, if our mouth could talk, it would tell us that the mouth is much more than just a cavity that the dentist can fill. It's a lot more than just some crooked teeth that an orthodontist can straighten. Your mouth and your children's mouth impacts every part of our life, literally from conception, the health of the mouth, to death. So let me kind of explain that a little bit. So our oral health impacts fertility, like in women, it impacts fertility. In men, the sperm count and quality. So literally from conception. During pregnancy, the oral health of a mother, a pregnant woman, can impact her own physical health. A poor oral health can increase the risk of, for example, gestational diabetes, preeclampsia. It can impact timing of birth. So you can have preterm birth or low birth weight of the baby. Because what happens if you have poor oral health during pregnancy, which is very common, by the way, 3/4 of the women during pregnancy, they have gingivitis. That's because of hormonal changes and cardiovascular changes. And the bacteria gets into the bloodstream through bleeding gums, travels everywhere in the body, including the unborn baby, and can cause some inflammation, local infections, and all sorts of things. So that's during pregnancy. Then as the baby's born, the growth and development of the mouth, which is again more than the teeth. The mouth is really all the way here. Your upper jaw is the nasal bones are all the upper jaw. The lower part of the eyes is the upper jaw. And then of course the lower jaw is all of this. So really everything in your face except the forehead is your upper and the lower jaw, the maxilla and the mandible. Because of that, of course, as the mouth is growing on a baby, it impacts their airway, their oxygen intake, which is such a critical thing during the first 5 years of growth and development, especially the brain development. Then it impacts their sleep. Obviously, their nutrition. If they have a tongue tie, they can't do breastfeeding. Impacts all sorts of things. Their oral development. As they get older, when they go to school, their oral development, the health of the mouth impacts everything, because the number one reason, for example, that kids get bullied about in school is their teeth. Kids who have an underbite, their teeth look because they look mean. Kids who have an overbite, they get teased because they look unintelligent. 51 million hours of school is missed every year because of dental problems. Kids with dental problems are 4 times more likely to miss school, 3 times more likely to get below average GPA because of lack of sleep, because of pain, because of lack of nutrition. Then, of course, it impacts their confidence and self-esteem as they get into high school and teenage years, where those seeds that were planted earlier, now we can see the result of it. And then as we get older, we enter the workforce. People with a nicer smile and a healthier mouth, they make more money, in average about $250,000 than another person with just the same qualifications. They have a better dating life. The number one thing that people find attractive in another person, the number one physical feature is someone's smile, above hair and skin and eyes and everything else. And then when we get older, our oral health impacts it's connected to almost every chronic disease, from cardiovascular disease to diabetes to arthritis and because of all of this stuff, it impacts our longevity. So literally our oral health impacts everything from conception to death and everything in between.
Well, I think just having better teeth makes you have a higher income would be enough of a pitch to get everybody to the dentist.
Yeah, think about it. So, because people always think about, okay, the cost of something, but it's also what are you getting for that value, right? What's the value versus the cost? So I'll get what you just brought up, which is perfect. The average cost of braces is about, let's just say $6,000 or $7,000, depending on what part of the country you're in. East Coast a little bit more. San Diego is about 7,000. Well, if you spend $7,000, if I tell you, hey, if you give me $7,000, I have an investment for you to make $250,000. That, I think you would say, I'm in, right? So, so that's the kind of investment that you're going to get back and return on just financially, just by having a nicer smile and being more attractive. On the health side of it, even for every dollar spent on preventive care, such as toothpaste and going to the dentist, for every dollar, you can expect to save about $30 in restorative care, like fillings and root canals and implants and bridges. So just the cost savings are astronomical, let alone the quality of your life and the longevity and having fewer chronic diseases and being more confident. So this is really what I want people to think of their mouth. And if your mouth could talk, it would tell you that your mouth is so much more about all of the things that happens in your life, almost every part of your life. And it's not just about a cavity in a tooth that a dentist can feel or some crooked teeth. These are signs that something's going on in your mouth. Cavities are not normal. That's another thing I want to really emphasize to your audience is if you get a cavity, just because it's so common, that doesn't make it normal. And so if you get a cavity, you have to think about what is going on in my mouth, that there's such an imbalance of my pH and the microbes in my mouth, the oral microbiome, that I have the hardest substance in my body, which is the enamel of the teeth, which is much harder than bone, which is getting a hole in it. It's really an unbelievable thing that as a society, we've come to just kind of accept that I get a cavity. And I think the reason is that people think, well, it's not a big deal because the dentist can feel it. But what they don't understand is that filling a cavity, it's like if you had osteoporosis, we just dug it out and we just filled it without trying to figure out what's the root cause. And so really my message to people is that oral health, because it's connected to so many parts of our life, the quality of life, the longevity, the chronic diseases, confidence, mental health, we really want to take it more seriously and take care of it. It's fairly easy. You just have to use the right oral care products, do the right routine oral care at home. And by the way, these are not that easy and that's why I kind of wrote 20 pages of my book is about what is the right oral care products? What is a toothpaste? Is fluoride good or bad? Does everybody need it? If you don't want it, what else? Is there an alternative to it? What are the other 20 ingredients in a toothpaste? Or mouthwash? Is mouthwash good or bad? Are you supposed to use it? Does everybody supposed to use it? What about floss? Are all the flosses the same? Do you brush your teeth before food or after food? These will all impact your oral health and ultimately your overall health.
Okay, great. Doctor, we are out of time, unfortunately. We have to kind of wind this down. Thank you so much for coming on the show. Do you have a website you want to give out?
Yeah, so people can go to themouthbook.com, or of course, my book is available on Amazon, Barnes & Noble, or your favorite bookstore.
Okay, is the book been out for a while? When did it come out?
Yeah, so the book, it's already a USA Today and Wall Street Journal bestseller, and it became a #1 national bestseller when it was released.
Oh, super. All right. Well, thank you again for coming on. It was nice meeting you, and
likewise.
best of luck.
Thank you. Thanks so much for your time.